Hi, this is Ed Tracy, and I'm here at the Wellness Center for the School Corporation here in Vigo County, Indiana. And we've been touring around, and now we have, we're going to talk to the person who makes this all run here in this clinic, and introduce yourself to the folks who are watching.
My name's Kelly. I'm the nurse, and I actually started with the company a few months after they opened. I originally started in ICU, and now I moved to the employer-based clinics.
As we said before, stress level, your blood pressure go down a little bit?
Different kind of stress, yeah.
And how many patients a day do you see in this particular clinic?
Really, it just varies how many patients we would see. It's anywhere. Some days we'll see 40, some days we'll see 20. We have very different hours here. We meet the needs of the employers. So on Mondays we're open for 12 hours, whereas on Tuesdays we're only open for 6 hours.
Okay, and
we do have Saturday hours.
And you have on-call hours as well. Somebody
Yes.
will come and meet them here or whatever if they need to.
It won't be me, but it would be the provider. They can email me at any time that they want if they have any questions that are urgent.
So your PA might meet them here in an off hour, something like that. And basically, what's your responsibility?
We do pretty much, the clinic's like a one-stop shop. So they come here, they can see the provider. We do all vaccinating here. We're really trying to promote preventative health care. So we take the patients back, we can draw their blood. We have a pharmacy here that stocks over, I want to say like 110 medications that they can get here free of charge. All their blood work's free of charge.
Okay.
They don't pay a copay. And then their long-term medications, we like to send them out with a 3-month supply, so that way they don't have to keep coming back like we would be a pharmacy. And it also cuts down on phone calls and stuff here for us.
What kind of feedback do you get from the patients? This has only been 18 months so far, right?
They really love it. They're really appreciative. They think, our PA is very knowledgeable, so everybody just raves about him. So that's kind of a good thing too. But as far as saving them money, and I really think you get better patient participation and trying to get more on the preventative side of things when they don't have the cost as an issue.
So you remove the barrier of the cost, and people are more willing to come and see you, and before it
try to make it friendly, and so they don't feel afraid. We're not like a normal doctor's office. We don't take walk-in patients like an urgent care clinic. We do see pretty much anybody that would call that day. We will see them on the schedule, but because we have a philosophy and we want to stick to that, we're not going to have just people walk in, because that'll just push other people's appointments back, and the whole key is to get them in and get them out. And
back to work.
Right.
Because your contract is with the school district here, or the school corporation.
Correct.
And so your concept is make it as convenient as you can, so they're not having to wait a long time, and it might be in the middle of their work day or right after work. And so you must have people who have come back more than once in 18 months.
That come every week.
So are you building a level of trust? Do you find that the relationships are building and the word is spreading?
Yeah, definitely. I think we have a lot of people that have basically switched from their primary care provider and just use us now as their primary care provider. And, they do anything from school physicals to sometimes they will do CDL physicals for the patients. They can do mole removals, pretty much anything that a normal primary care office will do, they will do here.
How's the work environment for you?
It's good. The workflow's nice. The good thing that I like about it is there's no money. You're not exchanging money, so you really cut down on confrontations with patients.
That's another barrier. That's an uncomfortable thing. Somebody comes to the doctor. They know that in that other world that they're going to have to pay, but still there's that uncomfortable feeling of they're going to make me pay at the window or what? It just didn't
Yeah.
seem, and this removes that barrier as well.
It does, and a lot of times when I schedule patients and they hear where we're referring them from to a specialist, they'll say, will you please remind them that they have to pay here? So tell them to bring their wallet so they can have their copay ready.
Right.
So we definitely remind them of that. And then another thing that we do, not only to help the patient, but to help, obviously, the school corporation, because that's who pays us, we've called around and we've gotten prices from the hospitals, the 2 hospitals in the area, some of the other clinics that provide MRIs, and then some local places. And we by no means try to make the patient or try to make a decision for the patient as to where they should go to get any kind of imaging done. But we just we provide them with all the information, because a lot of times doctors are getting paid out for that. Send them here and I'll give you a kickback, where we don't do that. We tell them, you can go to the hospital and get the MRI for $3,000, or you can go over here to this other place for $500, and you'll only have to pay your 20%. So it's up to you. We're just giving them the whole option.
If you're on a 20% copay, it's a huge difference between paying $100 and paying $500.
Yeah, so we definitely try to, we look at it from the patient point of view, but also to save the corporation money too.
Right. Well, that's great. I appreciate your time, and thank you for just sharing with people that are going to see this, and from 2 perspectives, from the patient perspective that you deal with every day, because you want to talk to the person that deals face-to-face with them, and from the perspective of maybe there's people looking for a career in this kind of field, and from your testimony, it's a great working environment.
It is.
Well, great. Thank you.
All right. Thank you.